communities. So whether you are joining us, next slide please, whether you are joining us from a hospital, pharmacy, community setting, academia, or the tech world, we are really thrilled to have you here today. My name is Lars-Åke Söderlund, and I am chair of the FIP's Technology Advisory Group, and I will be guiding you through this exciting and timely session focused on how artificial intelligence is shaping the present and the future of pharmacy. I would say that we are in a moment of transformation. AI is no longer a distant futuristic concept. It is already integrated into the tools we use, the medicines we develop, and the way we care for patients. And yet, for many in pharmacy, AI can still feel abstract or even intimidating. And that is exactly why we have created this session, to demystify AI by breaking it down, showing its real-world relevance, and addressing the challenges and ethical concerns that come with it. And there will be a total of 4 different events during the autumn, whereof today's event is the first one in a series of events titled The Promise of AI in Pharmacy Practice. Next slide, please. This webinar is being recorded and live streamed via YouTube, and the recording will be available at our website, www.events.fip.org. And you may also ask questions using the question toolbox provided at the bottom of your screen. And you're welcome to provide feedback to webinars@fip.org, because that will be a great opportunity for us to make the sessions even better in the future. And if you haven't yet become a member of FIP, I recommend you to become a member of FIP. It's probably the best investment you can ever make. Next slide, please. So Zoom has improved, and we now offer translations to your preferred language. Follow the steps on the screen. Turn on captions, enable the translation toggle, choose your preferred language under My Caption Language. And now you can follow along with live translated captions. Next slide, please. Here you can see today's program. We have 3 fantastic speakers with us today. Dr. Ferdian Jovan, Assistant Professor from the University of Aberdeen in UK. Dr. Amy Eikelenboom, co-founder of not an NAALA, not an average legal advisor from Netherlands, and Mr. Stephanus Hendrikz, Managing Director for ePharmacy in South Africa. Next slide, please. The learning objectives for today's event are: explain the fundamentals of AI, its subfields, and how systems learn and evolve. Identify opportunities and current applications of AI in healthcare and pharmacy, and assess key ethical, legal, and regulatory considerations in AI adoption. And of course, also critically reflect on the pharmacist's role in shaping responsible AI integration. Next slide, please. Now I would like to highlight some of the key resources developed by FIP that can support you and your pharmacist colleagues in digital health. Next slide, please. The FIP development goals, launched by FIP in September 2020, are a key resource for transforming the pharmacy profession over the next decade, globally, regionally, and nationally. And they align with FIP's mission to support global health by enabling the advancements of pharmaceutical practice, sciences, and educations, and are set to transform pharmacy in alignment with wider global imperatives underpinning the UN Sustainable Development Goals. And they now also align with all our work and inform our direction towards 2030. So the development goals, and especially the one for digital health, is a high priority for our profession. And the FIP development goal on digital health emphasizes integrating digital technologies into pharmacy practice to improve patient care, strengthen health systems, and build pharmacists' digital competencies through education, infrastructure, and supportive policies. Next slide, please. And with regard to the development goal on digital health, we aim to have a workforce and education strategies that focus on building digital health competencies, enabling pharmacists to use digital tools and data to improve patient care and health outcomes. We aim to have digital health technologies that are integrated into pharmacy practice to enhance medication safety, optimize workflows, and support decision-making and expand patient access to care. And when it comes to practice, advancement of digital health science promotes evidence-based use of technologies, ensures data security and interoperability, and drives innovation in pharmaceutical care delivery. Next slide, please. For more information and resources on digital health, please visit our dedicated microsite, developmentgoals.fip.org DG20. And next slide, please. Now I would like to highlight some of the key policy resources developed by FIP that support pharmacists in digital health and artificial intelligence. Next slide, please. The FIP Statement of Policy on Digital Health highlights the crucial role of pharmacists in realizing the benefits of digital transformation in healthcare, enhancing safety, effectiveness, efficiency, access, and equity through use of e-prescribing, e-dispensing, shared health records, decision support tools, telehealth, and remote monitoring. And it underscores pharmacists' responsibilities in ensuring governance, ethics, interoperability, data security, and patient privacy. And it encourages investments in digital and data literacy for pharmacists, patients, and health teams as well. Evidence-based adoption and benchmarking of new technologies, inclusive regulation and policy frameworks, and continuing education to enable a digitally enabled, capable, ethical pharmaceutical workforce. And you can find more information by scanning this QR code. Next slide, please. This statement, recently adopted at the FIP World Congress of Pharmacy in Copenhagen, brings together FIP's recommendations for a wide range of stakeholders, including policymakers working with FIP member organizations, patient organizations, and advocacy groups, technology developers, health insurers, pharmaceutical scientists, and the pharmaceutical industry, regulators, and pharmacists themselves. Its rationale is to highlight the vital role of AI in pharmacy and ensuring that AI tools are harnessed to enhance productivity and quality of care, while remaining aligned with the values of the profession and the needs of patients and healthcare systems. So this statement calls for addressing regulatory, ethical, and workforce challenges, and for investing in education and specialization so that the profession can fully leverage AI to improve medication safety, optimize therapies, and advance patient outcomes. It also emphasizes the importance of transparent, equitable, and beneficial adoption of AI, encouraging partnerships with healthcare providers, regulators, technology developers, insurers, and educators. Next slide, please. Now, finally, it is my honor to invite the first speaker, Dr. Ferdian Jovan, a lecturer at the University of Aberdeen in the United Kingdom, who will present What is AI? A Practical Guide for Pharmacists. Dr. Jovan is a lecturer in computer science at the University of Aberdeen and a visiting researcher at the University of Bristol. He is a world-leading expert in multimodal learning, machine learning optimization, and learning under data uncertainty, with a strong track record of real-world applications. In healthcare AI, he's played a key role in major projects like Sphere and PD Sensor, where he developed efficient deep learning models to assess Parkinson's symptoms severity using digital biomarkers. His work on edge deployment model compression received a grant from the Bristol University, and he has released 3 publicly available Parkinson mobility datasets that support ongoing clinical research, including the TORRES program. Welcome, Dr. Jovan, to give us your presentation.
Thank you, Lars, for amazing introductions. So, yeah, hi, everyone. Can we go to the next slide, please? So, yeah, we'll discuss what is AI, and I come from a computer scientist background, so hopefully if there is like something that I'm kind of like mistake in terms of pharmacy terms, please forgive me. Can we go to the next slide, please? So yeah, I mean, as already mentioned, I'm a computer scientist. I have expertise in applying machine learning technique from different sensors. We call it in computer science term multimodal data. So the data can come from nodes, for example, heartbeat, gyroscope information, camera, infrared, and stuff like that. My job is to kind of like merge them together and let the AI to be trained so that it can be deployed in real world scenarios. It just happens that these real world deployments for the AI technologies is around healthcare, assistive technology, and also robotics. The one that I'm showing you here is that where I applied machine learning models and optimized them so that they can be put in small devices like edge devices or wearables to track and learn typical movement behavior of a person living with Parkinson's disease. And why did I care about like this normal movement? Is that by knowing their typical or common movement behavior, for example, like say how long it takes to move from one room to another, like from kitchen to the living room. We're talking about the smart house here. The system can alert if the movement is deviate from like common behavior. For example, taking longer to move from kitchen to the living room. So because they live with a Parkinson's disease, then they need to take their medication daily. Then it can their medication, perhaps maybe because their medication starts to wear off, so they need to be reminded with our system to take their medication again. And it kind of like more in an efficient way, this is also can be useful for as a pseudometric to assess whether their new medications, assuming that they get their new drugs to deal with their Parkinson's symptoms, maybe it may have like a better effect or not compared to their old drugs, and we can use this AI technology for that as well. It's more kind of like derivation. Can we go to the next slide, please? So yeah, this is what we will discuss today. Hopefully I can cover everything within 20 minutes, we'll see. But in any case that maybe my presentation is boring or it's too much, then I just want you to take the main key takeaway from what I will discuss today. Is that the AI that we have now, don't treat AI as your autopilot, yeah? Treat AI as your co-pilot. So you can let AI handle routine work while you own the clinical decisions. So you can ask AI for help, but don't let AI influence your professional judgments. Don't let AI decide what's best for your patients. Yeah. So that's the main key takeaway. Can we go to the next slide, please? So yeah, in this part, so we want to know like why AI matters in pharmacy today. I want you to take this unreal imaginative scenario here, yeah? So let's say you are at the end of your shift dealing with a complex patient query about their health and their drugs. So let's say it's 5:30 p.m. So you want to go home, yeah? So you try to explain why they need, or perhaps they don't need to take certain medications via a leaflet that you provide. You try to explain in a more kind of like plainer terms or plainer language that the normal person can understand. It's sometimes quite difficult to provide information without like a medical jargon. So it might take you like 10 minutes to deal with that. Now at the end, you are faced with another choice, whether you need to dealing with organizing drugs or compounding drugs, or like organizing drugs prescribed by the GP or by the doctor that might be picked up later by your patients. Or the second problem is that dealing with backlog notes or invoices and all document related things. Because we are kind of like in the aging populations, there are more comorbidities from each patient, and each patient, it means that there is an increased patient demand, meaning that there are more paperworks. But in the UK, unfortunately, we also deal with the kind of like fewer staff problem as well. So there is a shortage everywhere for GP, for doctors, for nurses, and also for pharmacists. So I assume by the end that you really need to take the second option problem, dealing with all the backlogs before it gets larger and larger, and it might take you longer to finish them all. Yeah. So where do you think AI can help you here? Should AI help you with the first problem or the second problem? Can we move to the next slide, please? So from this kind of like unreal imaginative scenario, I would suggest to let AI do the words, yeah, and not the pills. Meaning that so you can let AI do the summarization, translation, information extraction that falls into the second problem category, yeah. This is kind of like a safer option for you and also for your patients. And it's better for you to do the first task or the first problem, organizing GP prescription, reading GP's prescription, doing the compounding drugs as well. For the kind of like reading, I mean, yeah, you can use AI as well, like a ChatGPT or DALL-E, something like that, to read the GP's prescription. But your expertise here must act as a guardrail to avoid the AI making incorrect diagnosis interpretation, yeah. And remember the patient who came earlier with a complex query, you can also use AI here to translate the patient leaflet into a plainer language that can be understood by everyone, even like teenagers or adolescents people. But again, remember that you need to check the content before you give it to the patient. Yeah. So while the AI deals with the patient and your backlog, you can focus on doing the critical tasks, critical things like compounding drugs. Yeah. Can we go to the next slide, please? So hopefully I kind of convince you a bit about AI is everywhere and it can be useful for you. Just be careful on the uses of AI. But yeah, in general, what is AI? Hopefully you already know what AI is. So AI basically just systems that perform tasks that normally require human intelligence. And it can be categorized, AI in general can be categorized into three, rule-based AI. This one is basically, you can think like this. You are an expert in pharmacy, yeah, field, and you want to work with computer scientists like me to come up with some kind of hand-coded rules, yeah, if-else rules, yeah, that the AI system can follow given a certain input. That's it. Yes, that's rule-based AI. Then you have also the data-driven AI. This one requires a lot of sample inputs for the AI to learn what the correct output is. Yeah. And finally, you have the optimization problem as well. This kind of like deals, for example, how to make AI less power hungry, how to make AI smaller, fit into wearable devices, edge devices, handphone, something like that. So in general, AI it follows the same step, yeah. So it always starts with the AI having or perceiving input, yeah, input samples or input, whatever that is. Yeah, it can be image, it can be signals, it can be notes, handwriting notes. And then the AI will do some kind of processing. It can be based on rule-based AI, or can be like data-driven. Then it will output something. That the output can be a prediction, can be a categorization, can be also a physical act. Yeah, physical act. If we're talking about robotics, then it will be a physical acts, moving something, or yeah, moving around or moving something. Yeah. Can we move to the next slide, please? Then in the AI itself, within the data-driven AI, you have subcategory called machine learning. Machine learning is just models that learn patterns from data instead of hand-coded rules. You remember there is the rule-based AI, then data-driven AI. So machine learning falls into the category of data-driven AI. It requires a lot of input data to get the correct output, yeah, for the AI to learn. And it follows kind of like the similar step like the AI formats. It's just a bit different in terms of now it requires data and to do the training, to train your model. Once you have the trained model, then it can do the prediction. And within the machine learning, there is like this supervised, unsupervised, and reinforcement type of the machine learning. Yeah, supervised meaning that you need input as well as the correct output for the AI system to learn what the correct output is. And within the unsupervised, meaning that you don't need to have the output or the label output the correct one. Yeah, so you just need to have the input, and the AI system will try to kind of like learn to separate the inputs based on the inputs, to separate the inputs, to cluster them together among the kind of like the similar inputs. Yeah. And then you have the reinforcement learning, or basically it's kind of like supervised, but instead of like a correct output, it will give reward, positive reward or negative reward. Don't worry about the reinforcement learning. It's more like it's applied more on the robotics and also in multi-agent system or agent system. Yeah. But the fun fact here is that if you know the ChatGPT, yeah, generative AI is basically trained on this following these three training regimes. So it started with unsupervised, and then it will go to supervised to hone the accuracy in terms of giving the answer for us. And then it also uses reinforcement learning as well to give like a feeling, kind of like an answer that is more accurate and more human-like, for example. Can we go to the next slide, please? Then within the machine learning itself, there is this one called deep learning. It's basically just machine learning with many layers or neural networks. And yeah, same, capture complex patterns. It's very good at text, image, and audio signals, but it requires a lot of data and computing power. The problem here also that it can be less transparent. If you remember that we have the rule-based AI. In the rule-based AI, that you can use the rule to explain the AI decision. Yeah, whereas in the classical machine learning, that is outside the deep learning. Yeah, that is not deep learning. The classical machine learning, like a regressions or regression model, linear regression model, then it has its own strategy to showcase which part of the input influence the most as a way to explain its decision. So giving like it has the output, it can kind of like highlight the input, which one of the information that is that influence the most for the output decision. But in the deep layer, it's a bit difficult, a bit impossible to do that. Because remember, this is basically layer by layer. It can start like minimum maybe 50 layers up to maybe a couple of 100 layers. And if you want to trace back, let's say you want to make it this deep learning similar to like classical machine learning, just like to highlight the input, what's the important inputs that can influence the most to the AI decision. It's difficult to trace back because of each layer will do a matrix multiplication as well as the nonlinear transformation. The nonlinear transformation is the problem here. It's difficult to understand why it gives the output like it is. So yeah, if you want to do use deep learning in pharmacy context, then it's better to have a monitoring strategy and also guardrails to make sure that it's safe to be used, and you can understand about reasoning. You can reason about the output as well. And that's why also that the research around explainable AI is kind of like a hot topic these days in computer scientists, to make this black box deep learning a bit more kind of like gray box than you can explain. So the system can explain itself why it gives that decision. Okay, can we move the next slide, please? And finally, we have this the latest, most advanced AI technology that we call generative AI, and ChatGPT, Gemini, and Copilot fall into this category. It's a generative AI and LLM, large language model. So in this one, it basically is that it's based on the deep learning. That is, when the model is trained, once the model is trained, is that it is able to produce an output without any input at all. Yeah. So if you want to spin it in a different way, it can produce output that is outside what it has learned. In this example, we can see from the slide, I have like a cat. Yeah. So the trained model, or like a ChatGPT, for example, it can produce an image of a cat out of nothing. Yeah. Not really out of nothing, but it starts with just like a random noise image. Yeah, like just like a noise image. It can be produced automatically from by the computer itself. So basically you don't need to provide any input. It can produce an image of a cat. Yeah. And this is a problem. This capability of producing something out of nothing, it can be a problematic that we call hallucination. So it can produce something that is incorrect, that is not a fact, and it can be troublesome later on. And we will, hopefully we have time to discuss that, and we'll see. Yeah. So this is the kind of like the Gen AI, or generative AI, is the latest and smartest AI technology we have so far. Can we move to the next slide, please? I think we can skip this one. Can we? Yes. So just to give you an example of real AI applied in pharmacy based on kind of like research. Here there is research done by Amador Fernandez. He basically wants to use AI for minor ailment triage and referral. So he used machine learning models, classical machine learning models here, with the input coming from the patient answers during the triage questioning, and also some medical record information as well, for the AI to, or for the machine learning model to flag or identify high-risk cases that needs referral, GP referral, or doctor's referral. Yeah, so it's basically, it works. The result is kind of like okay here. I provide the paper here, so you can take a look on that. So this his best AI model is able to correctly identify or provide a referral, GP referral, 75% out of the time. Yeah. So from everybody who needs referrals, the AI can give the same suggestion 75% of the time. So it misses 1 out of 4. So this is an example of supervised learning with the outcomes just a binary two classes by classifications, just either refer to the GP or not. And if you identify here, it's the keyword is the flagging, yeah, or identifying. So it doesn't give decision. Decision still comes from the GP, or no, from the nurses, or from you pharmacists. Yeah. Can we move to the next slide, please? Can I ask about the time? How much time do I have?
Uh, 2 more minutes.
Oh, okay, thank you. So yeah, and this one is kind of like similar to like before, but this one also involves the not only classical machine learning, but also deep learning as well. Here, same with the previous example as well. Here, the point is that they want to cut time, waiting time for the patient. So the patient basically discuss their doing the triage questions together with the AI. And AI will use that answer as an input for that, and also the medical report together to provide some suggestion. In this case, it's specific for people with heart failure conditions. And for the AI to kind of classify them whether it's a kind of like low priority or medium priority or high priority. And the kind of like the smarter bit compared to the previous one is that they also did some kind of feature engineering, meaning that if you look at the image here, that they kind of like input data has 25 variables. We call it features, raw features. It can be like the heartbeat information, tension information, something like that. Then they also, to improve the accuracy, from let's say 75% to maybe close to 90%, they did some kind of feature engineering to increase the accuracy, basically kind of like combining or modifying the raw features or raw variables into modified features. If you look again from this figure at the end, they have the heart failure data sets. It has 26 variables. So basically there's one extra variable made up from a combination of raw variables, to increase the accuracy. And the benefit is just like cutting time here. Can we move to the next slide, please? This is just an example for the AI to extract information from the prescriptions written by GP. Can we move to the next slide, please? Next slide, please. So we already discussed about what AI does well. So I want to kind of like emphasize when AI fails. So if you remember about the Gen AI problem with the hallucination, because it can produce something out of nothing, then it creates hallucinations. So it can make up facts. It can sound confident without any ground basis, solid ground basis for that. In general, outside the Gen AI problem, hallucination is basically specific for Gen AI, LLM like ChatGPT, But in general, AI can also have out of their context. So because perhaps like the guidelines like BNF changes and has recent updates, so it might give you suggestion that is incorrect in terms of time, It probably also has like some kind of hidden bias because it's trained from the most common data, for example, like say the most common majority ethnicity, for example, or age group, for example. So when it is like introduced input coming from different age group or different or minority ethnicity, for example, it can have a variable performance that can vary a lot. And also it has a brittleness in terms of like maybe it cannot really detect the very poor handwriting from the GP. So it can misread OD or once daily to QDS or the other way around, Can we move to the next slide, please? So there's also ethical implication once we have like over-reliance on AI, In this case, there is the problem with the explainability gap as well. If you remember that the deep learning is difficult to make it transparent or to be able to explain itself. So it's really difficult to justify whether it provides the right answer and why it comes up with this right answer. Meaning that the impact will be that there will be more and more weaker consent from patient and trust from the patient as well. And also the more impact from this is that there is also accountability drift that kind of like erodes professional responsibility because there is now this culture that the tool just said so and I don't know why. So it's it's kind of like making the patient's trust weaker more and more. And there's also the effect of like de-skilling, because I mean if you rely too much on the AI, then you basically kind of like lose your edge in the creativity, lose your edge in critical thinking, as well as you might make poor independent decision making. And finally, before I close this part, the other slides, hopefully you can see that yourself. I was just talking about the example there, but can you go to the previous slide, please? So the other problem with this relying too much on the AI is that there is an automation bias. Basically, we rely too much on the AI. We believe AI more than our professional judgment. And here, this is actually a very good example of that from research by Thomas. He tested that basically here doing automation bias in mammography. So he invited a lot of mammogram readers to read mammograms, mammography readers to read mammograms from very experienced to inexperienced. And they also provided suggestions from the AI. It's just that the AI suggestion is always wrong. And what we can find from this graph here is that so all the AI suggestion is always wrong, but the inexperienced tend to believe AI more than their professional judgment. Even the very experienced ones, they only managed to make it correct 50% out of all the time. Yeah. So even like the experienced one can be influenced by AI. The key takeaway is that don't trust AI so much. Try to use believe your professional judgment over the AI. Use AI as a draft. That's it. Yeah. Thank you for listening. Hopefully that all makes sense. And sorry for taking too long.
Thank you so very much, Ferdian, for this very informative presentation regarding the different concepts of AI as well as machine learning models. I agree with you that AI extends our capacity, but as we sometimes tend to be lost in all the administrative work, and of course it can help us with the words, but still as pharmacists we need to be responsible for the clinical decisions. So I think that's very important. And also this part of the hallucinations, it's really important that we verify the answers we get and how we provide these answers to the patient. So thank you so very much. And for all new participants, welcome to this digital event, Demystifying AI, Foundations and Opportunities. I am so happy to see that we here in Zoom and at our YouTube channel have more than 400 participants from all over the world. It is now my honor to invite the second speaker, Dr. Amy Eikelenboom. Amy Eikelenboom is the co-founder of NAALA, Not an Average Legal Advisor, a legal consultancy that supports fast-growing software and healthcare tech companies in navigating complex regulations. She specializes in privacy, information security, and medical device regulations. Amy leads certification projects for AI-enabled medical software, builds compliance systems, and advises a range of clients from hospitals to startups on data protection and governance. And she's known for her clear, practical approach to making compliance both actionable and scalable. Welcome, Amy, to give us your presentation.
Thank you, Lars. Thank you for the great introduction. Next slide, please. Yes, so as mentioned, I'm the co-founder of NAALA. Our mission is to make sure that we can actually make sure that the promise of AI solutions that we see in healthcare can actually reach markets. We still see too many solutions, unfortunately, being stuck in pilots and sort of hitting a regulatory wall if they actually want to make their impact into healthcare. Hence, it's our vision that new technology also requires new regulatory solutions. It's important to note that when we think about AI in pharmacy, it's not just the purchasing of a software solution. The difference is when you purchase a software solution, you are just in a purchasing role, but in the case that you purchase an AI solution, you actually become the deployer of an AI system within your pharmacy, which means that by law, you have specific responsibilities. So it's really important to be aware of that and to take note of that when you're considering integrating AI into your daily practice. Another thing to consider is that it could be a medical device or it could become a medical device. The one thing I really want to stress during this webinar is things and notes that sort of equips you all to ask the right questions when you talk to a technology party, either in terms of collaborating and making a solution together or integrating an existing solution into your practice. And that is, of course, where regulation comes in. It may sound a little bit like red tape, but we should really see it as guardrails, as also highlighted in the presentation from Dr. Jovan, that we have privacy risk, we have automation bias risks. So we really need to make sure that we implement the regulations, make sure that we comply, because this will ultimately lead to trust and transparency and accountability. Next slide, please. So when we talk about the regulatory landscape for AI in pharmacy, it's important that we are familiar with three major pillars. The first one is product safety regulation. So we have those in the European Union, but also in other countries for specific products for which regulators see that they have specific risks. So we want to mitigate the risks that come with those products. So we have them for medical devices. We have those worldwide. In the EU, we have them for AI specifically as well. The second pillar is that we want to, of course, protect privacy through data protection regulations. The third pillar that always comes in is information security. In some cases in countries, that is actually required by law, but nonetheless, we have an international norm that is generally implemented into technology to make sure that we can protect the sensitive data that we are processing with software solutions. Next slide, please. So what is important to note is that not every AI tool is a medical device. There is sometimes a confusion that we see. You can, of course, have AI tools that provide you a more of an administrative service. That doesn't mean that it doesn't need to comply with the AI Act. You may still be processing sensitive information. You still want to make sure information security is in check, but it may not automatically be a medical device. If it is a medical device, it is regulated under the local medical device regulations. So it is important to be aware that you may need to request their evidence of the implementation of those requirements. Next slide, please. So there is a little bit of a hidden risk I want everyone to make a little bit more aware of. And that is, if you include a general AI solution into your daily practice and you use it to assist you with clinical decisions or another medical purpose, you as the pharmacist become the manufacturer of that newly repurposed medical device under the local medical device regulations. So it's really important that by just, I call it maybe playing around with a general purpose AI model, you may actually become responsible for their output and become a manufacturer under the medical device regulation. So this is really something to be aware of. This is also something we always integrate into internal trainings when pharmacists start using AI. This is one of the requirements you have under the AI Act as a deployer of an AI system. So if you purchase an AI system, start using it internally, you become their deployer. And then you are required to have an internal, which is called AI literacy training, to make sure that all your colleagues that will start using the AI are actually made literate in how to use it. And this is one of the things that we always stress during those trainings, that you have to make sure that you stay, let's say, in the lane of what the AI is intended for and will be used for internally, making sure that you don't unintentionally make a medical device. Next slide, please. So then we come to the important question, how do I even know whether or not I'm making or purchasing a medical device? So we have a few questions at minimum in the European Union, but they are actually used worldwide for defining whether or not we are talking about medical device software. I've highlighted 2 out of the 5 questions because this is generally where the most debate is about. And the first one is the software actually performing an action on data beyond simple communication or storing of data? When we talk about AI solutions, we can generally say that they do perform an action more on data than something simple, just because of the nature of their technology. If we translate it to non-AI software tools, you can, for example, think about a solution that communicates information from the hospital to the pharmacy about a prescription, for example. So that is one-on-one communication. There's no action on the data by the software itself. The last question in this qualification flowchart is whether or not the AI is intended for a medical purpose. This is what I mentioned before, that you can have administrative purposes for which you employ AI internally, but you can also use it for a medical purpose. In that case, if you do so it provides both that action on data and you use it for a medical purpose, it will become a medical device under local medical device regulations. Next slide, please. So I have two examples just to highlight the difference between it being or not being a medical device. So if we look at example 1, you can have, let's say, a chatbot that answers FAQ questions on opening hours, anything you want to, that's generally also available on your website. Can you click on the slide, please? So you probably have guessed it, this is not a medical device. It doesn't provide an action on data. And even though you might be able to argument, well, it provides some type of information. Of course it does, but it doesn't, the software itself doesn't provide an actual action on data for a medical purpose. If we then look at example 2, we're talking about an AI tool that may assist in drug-drug interactions, contraindication, anything you can do that help you in the prescription phase to make sure that you can actually supply that type of dose and medicine to a patient. This is a medical device. It's even a medical device without the AI in it. So of course, if you do include the AI in it, it will definitely be a medical device under local medical device regulation. It's good to have that distinction in mind. Next slide, please. So what is my call to action then? It's quite simple, actually. It's don't fear the regulation. I sometimes hear that it's undoable or it's an innovation killer. It can definitely be that if people are too late with knowing what type of regulation they need to comply to, but also starting with implementing the right regulations soon, especially since they ask you for a lot of evidence on the development part. So if you have already a finished solution and then need to comply retrospectively, that's almost undoable. So we always stress that people need to start right from the beginning. What I really want to stress for the pharmacy industry is to be able to ask the right questions. So is it a medical device using the qualification rules we looked at? Am I using a medical device in a different purpose than it was originally intended for, potentially making me the manufacturer? And apart from medical device compliance, how compliant are they with their information security practices and with their data protection regulations? Since, of course, we're talking about very sensitive data, and that needs to be in place as well to make sure we can actually use it, adopt it, but also be transparent to patients and that they can trust the actual AI that you will be using. This was my call to action. If there are any questions, then we will have an opening at the end of the presentation.
Thank you so very much, Amy, for this very informative presentation about AI in pharmacy, the regulation landscape and the regulatory perspective, and also for the hidden risks for the pharmacists, because as you say, by using AI, we can be treated as a manufacturer. So we need to be, as you also said, critical partners, not passive users. Very, very interesting. Thank you so very much. And now it is my honor to introduce the third speaker today, Mr. Stephanus Hendrikz from South Africa. Mr. Hendrikz is the managing director of ePharmacy, a South African pharmaceutical innovation company pioneering patient-centric solutions to improve medicines access across sub-Saharan Africa. With over 25 years in the sector, he leads efforts in last mile dispensing, treatment adherence, and resilient supply chains. His award-winning team uses tech and public-private partnerships to serve underserved communities. And he is a respected leader and policy influencer, and he is also committed to transforming pharmacy into a more accessible, tech-enabled, and outcomes-driven profession. Welcome, Stephanus, to give us your presentation.
No, thank you for the introduction, Lars, and yeah, thank you for having me again. It's a privilege to share our journey with the FIP community, and I think it's amazing to hear the AI input from the previous speakers. So we can jump to the next slide so that I can give a bit of more context to everyone. So to give you an idea, we're based in South Africa and we currently mostly operate in Sub-Saharan Africa. And our team is basically for now about 85% focused on public health challenges. There's a long list, and I think a lot of the listeners and pharmacists on the call will relate to these, in the system. Overburdened facilities, shortage of pharmaceutical services, and then obviously manual patient and stock records, which is not a very good ingredient when you're talking AI. And then obviously pandemic readiness, what happened that COVID showed us when it happened, and then from a patient perspective, I would like to say that access and availability in our setting in Africa is a big challenge, and I think to give you an idea, we're sitting with about, just in South Africa alone, with about 22,000 pharmacists, not unemployed, but vacant positions. So those services are getting performed by nurses and anybody that's available. And then the negative economic impact from patients needing to travel to overburdened facilities and back, and sometimes obviously miss a day at work, and that becomes a monthly exercise when you've got a chronic disease. Obviously, we all know that South Africa has got a high privilege of HIV and TB. And then the natural patient experience, standing in those queues, the risk of co-infection, etc. And then, taking all of that into one sentence, can you just imagine the negative impact on adherence? So what we did was, in Radi Pharmacy, we started off, with our journey, but we decided that we're going to focus at a lot of these challenges. But the one thing we identified is, you can't manage the patient if you can't manage the healthcare supply chain. So for us, it was to have visibility where does the patient get its medicine. So our primary focus is in the patient last mile of medicine dispensing, distribution, and collection by the patient. So what we've occurred is a lot of fragmented supply chains. Obviously, geographical access makes it just more difficult with migration over borders. And what I'm going to do is I'm going to share with you guys just a short video to explain to you some of our products. We will, at another day and stage, we can zoom into each one differently, but this is just a high level video of showing all the programs and systems that we implemented in order to supply critical outstanding data with the patient in mind. So we can skip to the next slide.
In the current health supply chain, a crucial challenge is to increase commodity tracking and visibility through digitized data while providing accurate patient data during the dispensing, distribution, and collection of medicine. The visibility of this patient-centric last-mile data is essential for ministries of health, healthcare workers, patients, and funders. This constantly highlights the need for precise patient care management, assessing the return on investment of health programs, and delivering quality healthcare at an optimal cost. While much time and investment has been focused on efforts to achieve universal health coverage in Africa and other low and middle income countries, consistent health product consumption data remains elusive. Considering various complex environments with many challenges, innovative digital solutions at the last mile became increasingly crucial. Founded in 2016, ePharmacy, a health tech innovator startup, has prioritized resolving these challenges and data gaps using software systems, hardware, and integration capabilities. Through pioneering patient-centric solutions, ePharmacy has developed approaches that enhance access, availability, and quality of healthcare, along with accompanying data in the true last-mile environment. In 2017, our team introduced the first pharmacy dispensing units, commonly known as the ATM pharmacy. These units feature telepharmacy, remote counseling, robotic medicine packing, and product labeling. We achieved another significant milestone by developing and deploying Southern Africa's first robotic automated pharmacy system in the public health sector. As we identified additional challenges to improve access to healthcare, we expanded into more dispensing and distribution solutions. Our centralized dispensing solution manages the dispensing and flow of prescription medicines by synchronizing with multiple nodes in the healthcare supply chain. Through product integration, we developed a script digitization process that simplifies script receipt and management. This ensures that patient packs are automatically pre-dispensed from bulk using our automated medicine packer. Our integrated delivery application enhances logistic management, allowing patients to collect prescriptions from private pickup points or use our collect and go smart lockers. These solutions ensure that every data point feeds back into our centralized hub, which is then used to refine procurement and distribution strategies in real time. To ensure widespread adoption of our patient-centric solutions and programs by all stakeholders, our strategic approach includes training, change management, skills transfer, language, and cultural considerations for all regions we serve. Depending on the location and specific services or systems deployed, we creatively design marketing collateral, utilize various relevant media platforms, and establish engagement touchpoints to ensure precise targeting and user acceptance. Our journey continues to teach us many valuable lessons. Collaborations and partnerships with stakeholders in both public and private sectors foster a problem-solving culture which allows us to innovate, grow, and improve patient outcomes. This allows us to expand existing programs and configure our infrastructure to align with growing needs of disease-specific programs such as Test and Start, PrEP and PEP availability, and reproductive health programs. At ePharmacy, we will continue our pioneering strategy of innovating last-mile solutions to ensure that geographical location, socio-economic barriers, or systemic inefficiencies no longer impede access to quality care for positive patient outcomes. ePharmacy, advancing healthcare and enhancing lives through innovation and collaboration.
Yeah, if we can just go to the next slide. I think to give you an idea, so currently just one back, please. Yeah, I think to give you an idea of our impact currently in Sub-Saharan Africa, we've got about 108 sites, which is a mixture of all the products that we do, and we predominantly in South Africa, small footprint in Botswana, Eswatini, and Zambia. And yeah, we're looking to expand as we go on. We've served about 1.1 million patients already, with about 11 to 12 million dispensers. And I think it's important to know that, you know, the commodity tracking that we handled was about $32 million, which is data that never existed. I think, you know, the problem is, you know, everybody thinks pharmacy is or solutions are just a one size fits all. And I think what you've seen in what we presented is there's different solutions in different settings. Sometimes people get confused with the dispensing environment. Outpatient environment is totally different than a retail environment. A retail environment is totally different than an insured patient environment. A mining pharmacy's got a different regime of doing things. So it's for us to be customizable and to ensure that what we do to the benefit of the patient. I think what on the topic of AI fundamentals, in a low middle income countries that we operate in, I think, if you ask all the AI experts, obviously everybody's talking machine learning, fuzzy logic, systems, deep learning, data sets, etc. But for us, we've realized that, those are things that we need to get to first, so we need to overcome a lot of things by putting in those systems to generate those data in order to get eventually to AI learning and machine learning. So for a context of where we operate, it's not a joke, but we also need electricity in some cases to get things done. And I think that's what makes the context of the whole AI debate quite cool, being a pharmacist that's been allowed to operate and implement systems and innovations like this. And I think what we've done is we've busy and we continue with collaborations and tech partners and funders and donors to really look at solutions that can build that pool of data to the benefit of the patient. And I think to give you an idea, it doesn't help you buy a Mercedes-Benz, but you need to drive a gravel road, So we've been tasked in Lesotho to take care of their HIV and chronic patients. And we took some of the menu of products that you have just seen, and we basically puzzled them together in order to give them a program that is called Benolomeds. So Benolomeds is a program that we're very proud of. Currently, we challenge to keep that program alive because of the challenges with USAID funding, etc. But it's aimed at chronic stable patients that's been decanted from overburdened facilities. And we serve them not only where they want to be served, but we, in essence, give the right patients the right medicine at the right time. We can go to that video for you guys to just see Benolomeds.
The name says Bonolo, which means easy things.
They spend about less than 5 minutes to collect their medication, and it's wonderful for them.
For me, it's about bringing a difference in people's life.
I'm very, very happy. I'm very happy.
Benolomeds, I think, for me as a leader, is something which is very innovative, creative, and progressive, and is going to push universal coverage for this country.
So we think that we have a tool that will make medication easily accessible for Basotho, especially who need them the most.
As a Right to Care Lesotho, through our last mile solution provider, ePharmacy, we are bringing in this innovation to support the Ministry of Health in attainment and maintenance of epidemic control through decentralized drug delivery.
Right to Care strategic partners in rolling out Benolomeds program would be Right ePharmacy, would be USAID, would be the Ministry of Health, and would be Riders for Health.
The Ministry of Health is supporting this endeavor through engagement of its health workers, who are the ones referring the patients, and we are also providing these medicines that are being accessed to these Benolomeds, and we are also promoting the Benolomeds within our communities.
We have an opportunity now with the pharmacies in that they can come in and participate as a PPP and join the government in supporting the delivery of the needed antiretrovirals for Basotho.
Bonolomet is addressing the challenges that we face, because what we have realized is that the patients that we are seeing, most of them like in stage 1 of HIV. So having patients who are stable enrolled under Bonolomet will still give us time to focus on those ones who are more critical.
A demand creation officer is someone who helps the patients understand the program and teaches them about the program so that they can be enrolled and enjoy the benefits of Bonolomet. To have patients collect their medications at the e-lockers instead of the traditional way of having to stand in long queues to just collect medication. That has made our lives easier.
It destigmatizes having to go to the clinic. But also over and above that, I mean, some people do work. So after our access is also very critical. Knowing when you are getting your medication allows you to plan.
Ke ne ke tsoa hoseng, ke ne ke spenda tjhelete e ngata, ke ne ke ema di-queue nako e telele tsa tleliniking. So ka mora ho fumana ditaba tsa Bonolomet, dintho tseno kaofela di se di sa etsahale, se ke ba le lelapa nako e telele, se ke kgona ho etsa mabaka a mangata ke le motho.
To me, Bonolomet is a huge step for us as Lesotho, because now we are digitizing in order to improve access to quality services.
So it's a very exciting and very unique program that we're doing in Lesotho, and I think we're very proud of it because it in essence takes care of a lot of challenges in the public healthcare space, and this has been made possible obviously by the Ministry of Health of Lesotho, FHI our partner who we're implementing this for, and then obviously donor funded by USAID.
Bringing in ePharmacy as a partner who already has the experience and the technology to be able to implement something like this means that we have the skills, we have the capacity. People can easily incorporate this as part of their lives. They get an SMS that says, go pick up your drugs already. For us, this saves lives.
So you're in support of it, 100%?
And 1%, 101%.
Yeah, I think that gives you there is a bit of delay, obviously on the video. It's quite a high resolution video, but I think it gives you the essence of the program. And like anything, I do think everybody would ask what's the challenges when you innovate and you've got a journey of pioneering in innovation. I think some of the previous speakers have touched on these things, but obviously in a regulated environment, it's very challenging. And then obviously the bureaucracy, to get things done, the recent pulling of USAID funding, all those things got an effect. And then obviously getting through all the layers of ministries of health. Innovation costs money, and obviously that's important to understand. But then innovation, readiness is actually an opportunity, and it's like Jovan said. AI is not a pilot, it's a co-pilot, and I think that's important to note. It's we do use digitization of the prescriptions to take the burden of the pharmacist, but at the end of the day, the final checker or the authorizing person of that would be a pharmacist. Change management, people that doesn't have any systems need to be changed on how it works. Patients that doesn't know how to access technology, you have to make it as simple as possible for them to improve the access. So skills transfer, getting healthcare workers to realize that there's a benefit for them, and vice versa for the patients. I think it's important. These things take time. We've been very privileged to still be standing after all this pioneering stuff we've done. Integration, sometimes you need to integrate with old legacy systems. And sometimes there's no system, so then you have to implement them. And then obviously the big question is always the sustainability and the readiness of a government that's willing to take over a pilot program or something that's been working well. We can go to the next slide. Yeah, I think what we see is you've seen how we address healthcare challenges by using digital data and patient-centric innovations to create those data pools to the benefit of the patient. But what we do is we are actually laying the foundation for AI in pharmacy in our territory by generating raw data to allow insights via AI to positively impact the patient. So we see ourselves as pioneers in many ways. We will definitely talk to the more knowledgeable guys that in AI. Jovan, we can maybe have a talk, but I think the reality is we know what our role is in pharmacy, and we look forward to collaborating with people that understands the different sectors better than us. But I think our pioneering role to firstly generate that critical impact data is our focus. And then obviously converting invisible paper processes into digital scalable data sets. I mentioned to you, we're already doing it with the doctor's prescriptions, patient files, etc. But yeah, as we speak, things that's working for us, we haven't activated active AI as we speak. Like I said, it's a pioneering phase and building that data set. But currently we're doing prescription scheduling for repeat prescriptions, so the persons will know when their next repeat is. We obviously use automated WhatsApps and SMSs to keeping them, and telepharmacy to keeping them in loop. And then obviously we make sure the dispensing is done proactively for them to just arrive at their collection point for collection. Stock forecasting and demand. If there's no systems, that becomes problematic. So if you've got all those systems digitized, you've got fewer stockouts, less expiries, and reduced wastage. So, and then optimizing distribution, to ensure that the right medicine at the right time, at the right place, get delivered to the patient. And then strengthening the supply chain. The supply chain is a big word. Supply chain, it's from a manufacturer to a port, to a ship, to another port, to a warehouse, to a clinic, to a pharmacy, to maybe a district pharmacy, to hospital, and then obviously to a patient. And I think that transparency and predictability can only be done if you digitize the data that you're currently busy with. I think it's interesting when I started playing with AI, it became a bit of an office joke, but the one day I asked a lot of healthcare questions on ChatGPT, and the repeat or the feedback from AI was how he apologized was to say, "I'm sorry, I'm not human enough." And I think that sums it up for me. If you look at what the previous speakers have said, it's not a pilot, it's a co-pilot. And I think important is AI is also is for words and not for pills, by the previous speaker. So yeah, I think what we've done is we demonstrate how we could, underdeveloped countries can leapfrog existing technologies and innovations to basically use the opportunity. Tech becomes cheaper, techs become more clever, and the fact that some countries don't have any tech is actually an opportunity. It's not a challenge. There is solutions out there. There is experts out there. It does become cheaper. It's actually sometimes much easier to just leapfrog the tech that's available, and to make sure that we serve patients with the dignity they deserve. Just the last slide, please. Yeah, I think just a small mention, but this is some of the funders, ministries, etc., that we're working with, and it just shows you it's not a one-man show. You need people, you need pharmacists, you need healthcare workers, you need ministries, you need donors to assist you in order to pioneer these things. And my final slide sums it up. You can just bring that up. So without innovation and collaboration, we cannot advance healthcare. So I want to thank you for your time. Really appreciate the opportunity, and thanks for being part of this.
Thank you so very much, Stephanus, for this very interesting presentation as well. How you actually, by sort of solving the by using modern technology can actually increase access to medicines and pharmacy services. Excellent. And also for highlighting, of course, the challenges for innovation programs, but as well the opportunities for pharmacy. So I now would like to ask the speakers to turn on your cameras, and we have time for a short Q&A session. Some questions have been answered in the Q&A box, but still one of these questions I would like to address to Amy again. In legal terms, if an AI system makes a mistake that results in a bad outcome for a patient provided by the pharmacist, who is responsible?
Yeah, so that's a good question. I indeed briefly answered it in the chat, but it may be relevant to more people. So when an AI system becomes a medical device, then the manufacturer of that medical device is responsible for the workings of the device, for the proper workings, for making sure that there are no mistakes due to the workings of the device. This also extends to them instructing and, where necessary, training the users of the device in the proper use. So also mitigate any risks. There always remains some professional judgment and professional integrity from the pharmacist side. So in the event that actually really something happens, the manufacturer is the one that is required to report it to the local authorities. In case they have or they may suppose that it is due to the healthcare professional using it and not so much to the device, the responsibility can shift. So that's a case-by-case basis. Generally speaking, manufacturer is responsible for the correct workings. They are the ones responsible for reporting, following up, and making sure that it doesn't continue to happen. So they need to fix the solution. Thank you so very much, Amy. Stephanus, you have developed a very interesting model in the African region. Would you say it's challenging to pioneer healthcare innovations in the last mile of medicine, especially in underdeveloped countries and regulated environments, and perhaps in areas where actually we don't have any regulation at all? You are muted.
It's very challenging. I think it's got its benefits, its pros and benefits when you do it in a low middle income country, just because of the massive overburden of facilities and challenges we've got. So I think our philosophy has been close collaborations with regulators. It's a timely process, especially when you're innovating something that's not available. But what we've done is, we've taken the hand of the regulators as far as possible to enforce a pilot, maybe small, maybe sometimes we want something done in 12 months, it becomes 24 months, but that's the essence of the work we're doing. So it is very challenging. And I think that's part of our journey. What we've done in countries that doesn't have that, that doesn't have that, I would say, lack of I would say rules and regulations, we facilitate them with our learnings. We obviously collaborate with policymakers, universities, open debates, and we set the draft set of rules out for a pilot. So it's not a quick process, but they say if we all think the same, nobody's thinking. So we try to make sure that everybody is on par what we're doing. But it does stay a challenge, but that's become part of our success.
Thank you so very much, Ferdian. Let's assume that we want to pilot an LLM that summarizes information into patient leaflets. What metrics or key performance indicators would you use to prove its usefulness and its safety? And is there any stopping rule that must be put in place?
Thank you for the question, Lars. For the KPI or metrics that we can use, I would say the quality that is produced by the, let's say, ChatGPT summarization, make sure that it's kind of like readable, so readability metrics, so that every age group, perhaps like starting from maybe adolescent people and then towards like elderly, can read that. clearly and easy to understand. And we can also ask the participants to kind of like recall how much information they can recall from the summarization from this LLM. If they, let's say, successfully repeat like 90% of the time, then we can say it's a good quality summarization. We also need to include the consistency in terms of equity across like groups as well. Maybe in terms of the age, maybe in terms of the language as well. So we need to take that into account as well. So to show that it's consistent across all different groups. It can be age group or language groups. And then if in terms of like the stopping condition, so this is a leaflet that is kind of like summarized by the LLM or ChatGPT. Then if there is something like dosing information that is incorrect or contra information, then I would say this is 0% tolerated. Yeah. So this kind of thing, when that happens, this LLM, when you pilot it, and that happens, then it's better to kind of like pause using that LLM.
Thank you so very much. And linked to this question and answer, Amy, what is your experience? Do regulators know how to regulate the use of AI in pharmacy and healthcare? And do you have any good examples where they already have done this?
Yeah, so I can only speak for the European Union, of course. But yeah, they actually do know how to regulate it, also how to ask critical questions. So in terms of the parties that will actually, let's say, approve a medical device to be allowed on the market, they assign what is called notified bodies. So the European Commission decides who is able and equipped to actually certify medical devices. And with that assessment comes in, do they have knowledge of the technology they are actually assessing? In addition to that, they have their own advisory bodies that advise them on maybe changes or updates to regulations and to guidance documents that help with the understandability of how to make sure that your AI complies.
Okay, so would you also see for the future that in some healthcare systems, actually they will develop all these machine learning models, etc., but they will be sort of in a closed environment only for the healthcare system as such, so we don't get in so much bias from the world around us, I mean, from internet and everything? What do you see as a future perspective?
Yeah, so of course, bias mitigation is a very important part in getting your device actually certified. So dependent on the data you do use and whether or not you have properly mitigated bias, apart from whether or not you do that in a closed data environment, that's definitely something they look at. Of course, we do see international initiatives to make sure that data is allowed between healthcare providers. We have in Europe different regulations that are now allowing that more and more. So that hopefully will speed up the data quality that is needed to properly train these models.
Okay, thank you. And the final question I will actually ask Ferdian. You said that AI should draft, not decide. And if a model drafts patient-specific monitoring advice, where do you say is the line between drafting text and a medical device making a recommendation where the pharmacist is responsible?
So yes, thank you for the questions. It's kind of like in Amy's expertise as well. So I will try to answer here. So it comes back to the tool's intended purposes. If the tool's intended purpose is to kind of like influence the diagnosis or influence the treatment for a certain individual, or even like acts on that, like perhaps like starting or monitoring the heart rate maybe hourly for certain patients in a kind of like suggestive manner in terms of like the output, informations, then I would say this is already crosses as a software, as a medical device territory. But if it's like just let's say, summarizing information or reformatting the information using maybe cited guidelines, guidance that is approved, like a BNF, then I would say this is not medical device giving recommendation. Is just like information, because it's providing summarization or reformatting with a certain approved guidance from, let's say, from BNF or something like that.
Okay, thank you so very much. I think it's time to wrap up, and perhaps we have some slides, Madeline. I would like to thank all of our speakers for sharing your expertise, your experience, wisdom, and for providing wise inputs. And of course, to all of you who joined us today for Demystifying AI, Foundations and Opportunities. Our goal wasn't to turn everyone into an AI expert today. It was to build shared understanding and start meaningful conversations. So whether you are already working with AI tools or just beginning to explore them, today was about giving you the confidence to engage with these technologies thoughtfully and purposefully. So we have covered a lot of ground in just a short time. Ferdian helped us to build a solid foundation by breaking down the key concepts of artificial intelligence, from machine learning to natural language processing, and challenge us as well to separate the hype from reality. Amy turned to the critical issues of ethic, risks, and regulation with a clear reminder that AI, as it evolves, so must our conversations around bias, privacy, and accountability. And then we explored how AI is already being applied across healthcare and pharmacy with a very interesting digital solution from South Africa, providing patients with access to medicines and pharmacy services. I think what is clear is that AI is not the future issue. It is a current one. And as pharmacists and healthcare professionals, we have a responsibility to engage with it, not just as users, but as informed advocates for safe, ethical, and patient-centered innovation. So whether today sparked your curiosity, give you new language to explain AI, or raised important concerns, it is a conversation we hope you will continue. So we encourage you to share what you have learned with your colleagues, keep asking the critical questions, and look for opportunities to integrate responsible AI into your pharmacy practice. And check, next slide please, and check the FIP webpage and our social media channels for new episodes of the Promise of AI in Pharmacy Practice. And also at events.fip.org, you can revisit this session and other digital events from FIP as well. So before we go, a huge thank you again to our incredible speakers, Dr. Ferdian Jovan, Mr. Stephanus from South Africa, and Dr. Amy Eikelenboom from the Netherlands for sharing your expertise and insights. And thank you to each one of you for being part of this important dialogue. And of course, a big thank you to our FIP colleagues who have supported us with the planning of this event. And I also encourage you to reserve the dates, 30th of August to the 2nd of September 2026, where we will celebrate our 84th FIP World Congress of Pharmacy and Pharmaceutical Sciences in Montreal, under the theme One Health, One Pharmacy, Bridging Science, Practice, and Education. And on the 29th of August, it's a Saturday, we will also celebrate the FIP Digital Pharmacy Summit in Montreal. And one more thing before we close the session. Tomorrow, Thursday, 25th of September, is the World Pharmacist Day, a global celebration of the pharmacy profession and its vital role in healthcare. Now, in its 16th year, the day recognizes how pharmacists improve lives every day, from managing chronic conditions to ensuring the safe use of medicines. And this year's theme, set by FIP, is Think Health, Think Pharmacists. And it's not just a slogan. It is a reminder that pharmacists should be fully integrated across all areas of the healthcare system. Investing in pharmacists means investing in stronger, more accessible, and more cost-effective healthcare. And as the world faces rising healthcare demands and new challenges, pharmacists remain on the front lines, delivering vaccinations, improving health literacy, and supporting underserved communities. So this World Pharmacist Day, let's recognize and support the pharmacists, you, who are essential to building healthier communities around the world. Well, we look forward to seeing you at future events, and until then, stay curious, stay critical, and keep pushing the boundaries of what's possible in pharmacy. Thank you, all of you, and